Oh. What? Oh, I think we're good. Okay, keep an eye on it for me.
First gal you see when she's Ronnie and I have been doing his mic is truck.
Okay, are we ready to get started? Are we all sweating sufficiently? Okay, perfect. That's a good sign.
Thank you. Swear to pledge
Well, it's like the opera. It's ready to start.
The lights for you.
It's nice to have a table there.
Right.
Yeah, turn it all the way down.
Okay, perfect. Thank you all so much for coming. We appreciate it. This is a great turnout. We're excited to see all of you here. We're going to get started by talking a little bit about what the agenda is. I wrote it up here, and I realize now it's very small. So you'll just have to do by my vocal piece of it. But basically, we're going to start by letting the panelists introduce themselves and talk about a little bit about what they do, why they're here, why they care about healthcare, all the reasons that we're here. Kathy's going to do a bit of an audience introduction, so we'll figure out what that looks like when we get there. We're pretty tightly squeezed in here, so we can modify that as we need. And then we're going to open it up to a Q&A portion. A lot of people have submitted questions beforehand, and I have those here. When we get to that portion, we're going to pass out index cards. Once you have a question written on it, hold it up in the air. We'll get it collected and get it up here. Bear with us as we weave our way through the space. But we want to make sure that you all get your questions answered. And then at the end, we're going to open it up, open floor, ask questions, share experiences. Feel free to talk about why you're here, all of those important things. So before we get into panelist introductions, I can introduce myself. I'm Taylor. I'm Kathy's campaign manager. We are the group that's organized this event tonight, so thank you all for being here. Would you all like to introduce yourselves?
Sure. Hi, I'm Dennis McDonald. I'm the Jefferson County and Southeast Missouri organizer for a group called Missouri Healthcare for All. We're a nonprofit statewide organization. We have a pretty simple mission. It's that we believe every Missourian deserves access to quality, affordable health care, no matter where you live or how much you make. It's really simple and basic, and that's what we do. We do a lot of grassroots organizing, state lobbying in the Capitol, things like that, trying to improve the healthcare situations for Missourians. Obviously, right now, the big thing that I'm sure we'll talk about a bunch tonight and is going on in state right now is the Medicaid expansion ballot initiative, which we're working towards. So, healthcare is important to me. I get really excited about it, and I can ramble on forever. But like a lot of people in this room, I'm sure I have a personal connection that I struggled with getting access to healthcare, like a lot of our neighbors and stuff like that. So that's one of the reasons that I'm really proud to do this work and happy, and I'm super stoked that there's so many people here talking about it. I think it's amazing, and I wanted to tweet out, don't tell me people in outstate don't care about these issues, because I think you guys should all be proud of yourselves for being here. So, thanks.
I'm Kathy Ellis. I'm running for the 8th Congressional District, and I'm very pleased to be here tonight. Healthcare is one of the things that I think is so important, and particularly in our district. I have been a clinical social worker and an addictions counselor for over 35 years. And believe me, I've had to work with people who've had insurance and haven't had insurance and who've had nothing, and we all need to have health care. We all need to have access to health care. We all need to have health care that is affordable. And we are all in this together. This is our fight, and this is the fight of a lifetime, and we need to take it seriously and make it happen.
My name is John Roberts, and I've been in family practice in Mountain View for 42 years. I'm the medical director for the Good Samaritan Care Clinic, a free clinic we started 15 years ago. We had 32,000 clinic visits, and we have 2,000 on our waiting list for dental. I appreciate the opportunity to be with you this evening. If there's anything that's dear to my heart, it's how do we improve health care to rural Missouri. I live between Ellington and Winona, and in 2016, the closest hospital was 25 miles away in Ellington. Now, I sent some pictures out what the hospital in Ellington looks like today. So in 2019, you're looking at a hospital where the grass is replaced by weeds. And if you went there, you would see the doors are locked, and you would see a note on the entrance to the emergency room that if you need emergency care, go to the closest hospital, which happens to be Ironton.
Oh, Ironton.
45 miles away. So now there are 600 hospitals that are in dire straits right now in rural area America. One of them, is Ironton's not financially as stable as they would like to be, and we don't know what the future for the hospital is going to be there. I visited with a physician's assistant that flew many years with AirVac, and he flew in many times over to Ellington to the hospital there, and he said for some reason they got some of the worst trauma and some of the sickest patients. By the time we got the helicopter and flew into them, they had the patients stabilized, and they were able to transfer them on into St. Louis. The needs of rural hospitals in America. I visited with a lady down in Ellington, and she said, I know two or three people that have passed away that I think if we still had our hospital would have lived. Well, statistics show when you lose your hospital, the mortality rate goes up 6 to 8%. So it is so important we keep our rural hospitals. Last year, just in southern Missouri, we saw 2 hospitals close. Saw the one in Donovan, we saw the one in Kennett, Missouri. Often the hospitals in the area, not only do they provide good medical care, be there for emergencies, but in many rural communities, they are one of the top employers of the area. I know when Ellington closed its doors, 65 people lost their jobs. And for a small community, that can be devastating. So again, appreciate the opportunity to be with you. Expansion of Medicaid, there's a lot to be said. We know hospitals are closing, and most of those rural hospitals are closing are from the 14 hospitals that have not expanded Medicaid. And if you expand hospital care now, there's a good chance that your hospital can be saved. So I appreciate seeing you all this evening and try to answer any questions I might be able to help you with. And I certainly appreciate Kathy and what she's trying to do for our area. Thank you.
So before I let Kathy take over, I can give you a little bit. So our thought process as we were trying to figure out, where do we go? What's our next step and what do we do? We thought it was really important to start bringing people together to have these conversations. Because we may not agree on the solution, and we're gonna talk about all kinds of solutions here, but we can agree there's an issue. And so it's important that we start coming together, talking through our experiences, where we're coming from, and what we can do to move forward. So that's the framework for this conversation. And so Kathy and I put together some guidelines just so that we all feel comfortable in the space and we can have this conversation in a productive way. They're very simple. Participate with intention, appreciate the diversity of perspectives. We don't know where people are coming from or what their experiences are, and we want to make sure everyone feels comfortable in this space and treat others with respect. So as we move forward in this conversation, keep that in mind both towards one another and towards our great panelists who came here to talk with you all. So I will let Kathy take over.
Okay. Well, one of the things that, as Taylor said, just bringing people together, having community, even if it's just for an evening, even if it's just for 5 minutes, because we are a very, very large, very diverse district. And so it's so great to see so many people from all different parts of this district that are here tonight. So I really appreciate that. So like in church, every once in a while, you're required to do the little like handshake of peace and, you know, greet your neighbor and that sort of thing. So I'd like you to look around and I'd like you to turn around to somebody close to you that you don't know and introduce yourself and tell them why you're here.
It's working? Okay, good.
Okay, so the next question is, one thing that I'd like to take away from here tonight, find somebody that you haven't talked to and tell them that, share with them. What are we sharing with them? One thing that you'd like to take away from tonight.
I'd like to take away more. And you can feel free to text me anytime. Sure.
All right. All right.
Yeah, my name is left, by the way.
Okay, you ready? Okay, so thank you all for meeting one another. That was important to us too. We know so many of you, and so many of you don't know one another, so it's nice to bring you all in the same space. So we're going to open it up to the question and answer portion. So I have some questions that people submitted beforehand. Did folks pick up note cards on their way in? No? Okay. Let's grab some of those and we can pass them out.
Pick one side of the room.
Thank you all. And then whenever you have a question written on it, if you just want to stick it in the air, we'll pick it up, and then we'll funnel those into our stack and get to as many as we can. You're ready? Oh, we'll get you one.
Give them a little more space.
Did you get one? Anything, Pen?
Yes.
Got one? You share?
Did you all like? Nope.
Thank you.
Do you like one? We've got plenty, so if we need more, let me know. Does anyone else need a note card that didn't get one?
Oh, they're right here.
If at any point during this you didn't get a note card and you would like to have one, just stick your hand up in there and we'll grab you one. We're very informal here, so. Okay, cool. So we'll get started with some of the questions people submitted beforehand. Once you have your question written, stick it up and someone will come around and grab it from you. Okay, cool. So we wanted to start, we got this question a good amount of times. How would you all summarize our current healthcare system? What do we have right now? Dennis, you want to start?
Pay to win.
Yeah.
I mean, that's the shortest phrase I can think of. Private insurance companies are generating immense profits, and a lot of us are priced out or don't have access at all. Or if we do, it's barely hanging on. Hopefully, no emergencies happening type of situations.
I would say it borders on chaos at times, and there is a lack of equality in services. I would say that there is a wonderful opportunity to begin to change the way we look at our healthcare. And I think that we want to take advantage of those openings.
I ask people all the time, you have health insurance. A good example are our aides that work in the nursing home, and they make $10 to $12 an hour. Nobody works any harder than they do, but they can't afford health care. So I was in West Plains the other day and talked to one of the aides. I said, "Do you have health insurance?" She blew me away. She said, "Yes, I have health insurance for myself and my daughter." I said, "Do you have it through the nursing home?" And she said, "Oh no." She said, "I have to drive 80 miles round trip. We live in Arkansas, and I have health care. My daughter has health care," and she said, "We even get dental care." And she said, "I'd like to live in West Plains, but I can't give up my insurance."
Wow.
So our system is broken. One word, broken.
I'm J.C. Kushner from Eminence. I was state representative for Ironton County from 02 till 10. In fact, one of my first projects I worked on with the county commission was getting the hospital built out there. So this is near and dear to my heart here in Ironton County to see this hospital in financial trouble. I'm on a hospital board. It's a Mercy Hospital in Mountain View. And I can tell you that healthcare availability and quality is going down every day, that something's not done. More and more is being taken away from citizens like ourselves. It's going to be a bottomless pit with problems unbelievable unless we can stop that trend and turn it back the other way.
Okay. What is one myth about healthcare that you would like to dispel? So it could be about health insurance, healthcare, however you want to take it. We'll start back to Dennis.
The same myth that goes with so many of these issues, and that's the idea that people that don't have it somehow deserve not to have it or did something to get in that position, that somehow they made a bad choice 10 years ago that led them to this road. And I think a lot of us can see that that's simply not the case, whether it's we're talking about the brokenness of the system or people not having access because of distance or a state line, right? I mean, it makes such a huge difference, especially considering some of our neighboring states have expanded Medicaid. So I think the myth that it's deserving in some way, that it's not, that people, that we should live in a country where not having money is a good enough reason to not have access to health care. I mean, it's just, that baffles me sometimes when I hear people trying to defend that position.
Yeah, I've heard that many times. I've heard a lot of it from Jason Smith, actually. And, you know, the reality of it is, we are all human beings, and we are all going to die. And we're going to get sick at some point in our lives. And we all need to have that access to healthcare. And I think the myth that we have this wonderful healthcare system, which part of that is true, but it needs to get to everyone.
I think one is that both state government, they say, we can't afford. Well, you cannot afford not to do the expansion in Medicaid. So we have a group of legislators in Jeff City and in Washington that, well, we just can't afford it. We'd like to have it, but we can't afford it. And that's certainly a myth, because we can't afford it. And not take it away from education, which is what they're trying to make you do is feel bad.
Can I jump in with one more thing here?
No, that's a good point.
I think that our legislators in Congress, in the Senate, all across the board, need to have exactly the same health care that everybody else.
Amen. Yep.
That the special health care that they get isn't carved out just for them. They either give it to us all, or they don't get it.
Exactly.
There's two myths that I see from being in the legislature. One was what our legislators believe is that if we let insurance companies run the whole system again like they have in the past, that healthcare coverage would improve. But we saw pre-existing conditions come along in our lifetime, some of us sitting here. And what's to say that pre-existing conditions, if they take over again, and that's what's going to happen unless this is not turned around, the pre-existing conditions won't be something that your grandparents had, or pre-existings won't be for sure something that your parents had, because we know that genes bring that on down the line. So the second myth is that, well, I have insurance, and so it's covered, and I have a policy that I have about 3 pages that covers my whole policy. Well, that large building in St. Louis or Kansas City or wherever is where all the paperwork's at, and there's lots of little fine print in there that, yeah, you may have thought you was eligible for this, but how many have read their policy? How many in this room, raise your hand, have ever taken your total insurance policy and sat down and read it? You take it for granted. You're exceptional. That's good. You're exceptional. And so we presume what is not real.
I don't understand it. I tried to read it, and
Exactly.
it just makes no sense to me.
And they write it that way.
You better believe it.
Okay, this is a question someone submitted here. Dr. Roberts, this is for you. Can you zero in on the connection between rural hospitals closing and Medicaid coverage? How are they connected?
Well, what's happening right now, the people that are using the ER, and if they find that don't have insurance, and they can barely get by on a day-to-day basis, so they go to the hospital, and the hospital writes it off. They may threaten to sue them, they may sue them, they may call them. They just don't have the money. So our hope is, and I just talked to the administrator over in Texas County, Houston, Missouri, and he said it'll make or break our hospital. So it's better to get a low pay, which Medicaid does not pay well, either the physicians or the hospital. And that's the reason a lot of physicians don't want to take it. But it's better than nothing, and that's what they're getting now, because they take poor people. Representative Ross represents Texas County, and he met with the board, it's been several years ago, and the paper interviewed him, and he said, if a hospital's in trouble, it's because they have poor management. No, it's because they take care of poor people that can't afford their bill. Well, he retracted that statement later on, but they do. Rural hospitals take care of the poorest people, just like in inner city.
There was a whole series of articles in the Post-Dispatch just recently about the attempts by rural hospitals to collect debts, the people that
Poplar
owe them.
Bluff in particular.
And it was very eye-opening, coming from the perspective of being in healthcare, I'm a nurse. Medicaid expansion will not only help those people who are recipients, it will help everybody, because that will help to pay nurses' salaries. It will help to keep people healthier in your community, which people want to be in an area where they have good healthcare facilities. And unfortunately, the job base in the rural areas doesn't support a lot of high-paying jobs. Like you said, some of the highest-paying jobs in rural areas are in hospitals. And people will not use the ER if they can go to the doctor's office. Those people that are seen time and time again in the ER are seen there because they don't have insurance, and no doctors will see them in the office. So they're sicker, so you're taking care of a person when they're further down the slope to illness, and they're much more difficult and costly to take care of.
Very true.
Dennis, do you have anything to add?
I was gonna say that, it's good that we have a long time to now, we can look at this. It's sad that it's taken this, that we haven't expanded Medicaid in our state yet, but it's really easy to compare. 72% of the hospitals that have closed in the United States in rural areas, closed in states that didn't expand Medicaid. Okay? We can study, and there's been the study out of WashU that have showed not only is it's beneficial for the state's budget, but it's beneficial for all the communities. So it's like, you know, this isn't, we're not just spitballing ideas here. There's hard evidence and hard data and facts behind the idea that this is beneficial all the way around. So I mean, it's been 10 years, so we have a long enough case study, I think, between us and other states to see that it's beneficial all the way around.
The state was making money on the old Medicaid system. The state would have a windfall on this, spending 10 cents to get 90 cents, turn 7 times, turn that into sales tax, income tax, etc. for the state, counties, cities. It's a windfall, not only for the healthcare system, but for the government as a whole. What a shame.
Yeah, absolutely. Dennis, this is,
I was
Yeah.
just gonna add to that it isn't only good for the hospitals and the nurses and the recipients of Medicaid, but, you know, if you've got someone that can go to the doctor and get treated for something, they feel better and can go to work, they can be more productive, and it can just help the whole community. Employers aren't having people out sick all the time, or, you know, where they can't come to work. And it just helps all the way around.
yeah.
I teach adult education, and right now I've got a woman in there who's trying to get her dental work done. And it just boggles my mind that people don't realize that when you have decaying teeth, which she does have, there is so much closer to the brain. I've had students who couldn't get their psychotropic medication because they couldn't afford it, and they just had to focus and make sure that they didn't do something. They had to really work hard. And when you're dealing with that, how do you learn? To me, it makes economic sense to have healthy people, whether it's vision, dental, hearing, physical, I mean, you know, just personal health. It should all count, because if you have a healthy person, they are going to get that degree faster. They then can go on and do other things, and you are going to then increase the work productivity in your community. And I don't know if it's because we're in a rural area, so we don't count to the big people in the major metropolitan areas. That, I don't know who the guy is up in St. Charles who's talking about that he doesn't want to get involved in Medicaid because that gives the federal government more control over the state. And I keep thinking, who pays the taxes that we're doing? It's my money. Bring it back into my community and let me get my people educated so they can go out and get a good job. And it just makes no sense to me.
Yeah. Go ahead, Kathy.
Well, you know, I bought a Jeep Cherokee several years ago. And so it's got the warranty, and then I bought the extra warranty. So about after the first warranty ran out, my horn went out. And this was supposed to be bumper to bumper, okay? And so I went to the dealership and they said, your horn's not covered. I said, it was a hot day, I was a little mad. So I said, come here. I said, what's this? He said, that's your back bumper. I said, come here. I said, what's this? He said, that's your front bumper. I said, what part of this in the middle is not covered? He said, you're right, ma'am. We'll take care of it. Our healthcare is like that. Why do we have vision excluded? Why do we have dental that's a separate thing? Why isn't it not one whole package? It would be much more cost effective. We would benefit so dramatically from it, you know? And then we have to also bring up pharmaceutical industry, which I think somebody has a question about that.
So what's your questions now? Dennis, this is a good follow-up question for you. What are the steps to getting Medicaid expansion passed?
There you go.
Well, the first one is what I've seen some people doing today, and that's gathering the signatures. I don't know how far you want me to go into the details of how that works statewide. First, I just wrote down this. The first step is to get it on the ballot, and that's what the signature gathering petition is all about. You need to get a certain percentage in 6 of the 8 congressional districts across our state to get it, and then sent off to Secretary of State. Back, it takes a long process, approved. Once we get it on the ballot, then we got to get people out to vote. And again, that's a statewide effort. So every part, every county, every town, every
Are you aiming for the
every cricket
2020
group.
election in November?
Yes.
Okay,
Yeah,
so
absolutely.
that's when the most are gonna turn
Oh,
out?
yeah. And
When are you starting to put out the ballot or the petition?
we launched November, the Labor Day weekend is when the official launch was. So
They're in this
getting them
room
out.
right now.
We have some petitions here.
So-
If you want to sign it before you leave and you hadn't had a chance to do it,
Now, they have to be by county, right?
Yes.
We got the counties.
If
We got 'em.
you think you've signed it already, if you want us to sign it again.
Please don't sign it twice. I appreciate your enthusiasm, but it's one time only, and you have to be a registered voter. So if someone wants to register that day, they can't sign it, right? So I mean, that's kind of important too. But if you run into people who aren't registered to vote, you should be telling them to do what? Register to vote, then you can sign a petition later, right? So we sign it.
And when is the deadline for it?
It's December-ish. We're shooting to have them collected in by December.
Do you have any idea how many customers?
I don't. We just started turning them into the. I kind of, my limited area that I focus on is just the southeast part of the state, so I kind of funnel them up towards St. Louis to the main office up there, where they're doing they have another company that goes through and sorts and all that stuff. But it's basically spreading the word, talking to your neighbors, getting it on the ballot, and then getting out and voting. So
Did you have a sign up via Facebook
for
for the ballot?
putting your, like for the.
I think you have to sign it physically.
Okay.
Oh yeah, sorry,
You
yeah,
can't
sorry.
do it electronic. It would be a great idea, but.
Yeah, no, it's a legal document, yeah, and it's gonna be notarized, yeah, it goes through a whole process.
Yeah, good question.
This is the first step, really.
Yeah,
I thought something was going on.
This is an offshoot of that, but I'm wondering, what is going to happen with the 120,000 people that have been kicked off of Medicaid? 90,000 of them are children here in Missouri. Is our legislature going to have hearings? What do we know about that? Because I know some families that were paying their premium and they went to their doctor and they said, you don't have Medicaid anymore. They said, well, you've been taking my money for the last 3 months. So could you address that real quickly, since we're talking about?
Yeah, there's 2 things. The Medicaid expansion solves a lot of those issues. States that have expanded Medicaid have a 3 and 4 question approval process. It's really simple because they've changed right now we have a lot of, does anybody in here, if you don't mind raising your hand, got a Medicaid application for children or something? It's several pages long. It's a lot of work. A lot of those kids they would get the application, have to turn it in 3 days. So not have time to do it. So there's a lot of stuff that kind of goes away if we solve it with this Medicaid expansion. That being said, they did have hearings on in Jeff City about a week ago, I think. It was. They can't get an official, during the recess session, they couldn't get an official hearing. They had an informal one in the basement, and there was a lot of people from all over the state. It was really, really powerful to see that many people that ended up showing up and coming to share their experiences with that. So that's a question for the legislators ultimately, or, get in a room and get your neighbors together and call and write letters and go to the Capitol and let them know
And the responses that people have gotten from the legislators are that our economy is just that great and that many people have decided not to participate in Medicaid
And that's
expansion.
poppycock.
Or they said it's an accounting error. Those
Yeah.
are the two things that I've heard the most.
I attended that meeting a week or so ago, and it was a very eye-opening meeting. There were lawyers, there were social workers, there were teachers, there were nurses, there were people from all aspects of life. Yes. And they talked about the problem that people are experiencing. A mother with, her kid, all of a sudden kicked off. They go in for, a meeting with the doctor, and they say, well, you no longer have it anymore. It's because poor people, for some reason, if we can't figure this out in this room, I don't know why,
Right.
they move a lot because they have to move for jobs, and their wages vacillate widely. And so there's a lot of reasons they can kick them off, and they're looking for reasons. And then it's not bad enough that, every 4 years they're supposed to renew and upgrade everybody's, application. But then they have to make the doggone application form so complicated that lawyers can't understand it. And that's the thing about Medicare expansion. If we go to that, it's a much simpler form. And the amount of coverage that is increased it's still disgusting. It's too low, but it's dramatic. And you've got to look at it from the standpoint of the people that are suffering all across this country. We had a rally in West Plains here several weeks before that, and people would, usually it was young mothers who had their kids kicked off. Some of them just had their heads down like, it's just another thing they've thrown in my way, and they're just going to go on. They're going to end up not signing back up because it's so complicated. So the government, they think this is a big plus because we don't have to pay out this money now. But who's losing? Those kids are losing. Keep that in mind.
I talked to the ranking member on that committee today. She said that it's 55 days in Missouri on average to get approved. If you have an emergency problem, you need surgery for whatever, it's 55 days to get approved. National average is 7 days. 30% of that national average is within 48 hours. That's what we're dealing with. More difficult, people give up.
Is there a way we can get information like this? I mean, I keep thinking, one of my students her 3 children were kicked off, and she was one of those that didn't know it. And to me, a letter writing with facts behind it, if there was just something you could throw on Facebook or something to say these are statistics that are something we can write to our legislators and say, don't give me this garbage that you're trying to do. That these are the stats. It's costing the state of Missouri money. Right. And I don't understand that they're trying to say, I don't understand the mentality of why they don't want to do it. It would be more cost effective in the long run to have healthy children that are covered and, create jobs and do that. And if you just, where they're keeping their heads, I have an idea, but I don't think I ought to say it here. But if you could get us a stat sheet of some sort, or is there someplace to go, a website or something that would give us that information?
I know a guy.
Huh?
Don't leave without talking to me. Missouri Healthcare Fraud. I mean, that's what we do. That's kind of
Well,
one of our.
actually, I'm a member. I need to start reading my stuff.
Yeah, we definitely do, but especially with the letter writing and stuff like that. So.
I didn't catch the deadline date for the petitions that you had.
As far as I know, it's still December. It's in December.
It's December.
End of December.
Yes.
Did they change the rules on the petitions where, it was gonna cost $5 per name and, Missouri was working on,
Not yet, Ed, they're wanting to.
Yeah, they're wanting to change
You have to
Yeah.
how things get on the ballot.
Yeah, no, that.
So we ought to get this one done as soon as we can.
Well,
And still-
that would take a constitutional amendment, right? For the Missouri Constitution? Yeah, the Missouri Constitution, doesn't it set those rules?
It might be statute, because I know they had talked about doing it.
They want-
Last term, they didn't get there, but I know that there was talk of it.
They wanted us to pay $5 to sign it like this petition here.
Oh, I don't know about that, I just know they were trying to make it harder to get things on. Right.
Oh, okay, a constitutional amendment, they don't want people doing that.
Well, they want, I thought it was that, that's what the petition, the people that were running the petition, they were gonna get charged $5 a night for the Attorney General.
No, he's right.
Yeah, sorry.
Well, that's what my question.
I'm sorry, it's not 2 months from now, the deadline for the 2020 ballots, like, it's not.
It's December of.
Right, we have plenty of time. I didn't mean to make it sound. I'm sitting here, I was like,
But, no.
no, it's not, it's gonna be, what month is it now?
Today's, it's October.
It's months into the future, yes. Yeah, it's not December.
13 months before.
Yeah. We have some time. I don't know when the exact deadline to get them turned in is, but it's not in 2 months.
But if it's, okay, so by the end of the year, they're turned in, when would the vote be? Would it be in?
We're shooting to get it on the 2020 ballot. Yeah. So, and I don't know the exact time. We have to give them time to collect them, then they approve. The state takes them, sends them out, so there's a time frame, but we're not up against the back end of the time yet, so, sorry.
Can I just, we're all, I think everyone here is on the same page, and it sickens me to know, because I work in healthcare and have for 38 years. And we all talk, and it's horrible that children get cut off their insurance, because there's nothing worse than seeing a parent come in with a sick child and they don't know how they're gonna get them taken care of. It makes me ill. And everyone here cares, but if everybody's doing well, everyone's doing well. And the people that are running our political machine right now, they don't care. And that's what we have to change, is the people that are in there. So if we can get people to vote so that this will change, because they don't care in Washington, or in maybe even the state house, that people are dying because of this. So they have to go. Because they get health care. And so people need to understand that. A lot of people I know that we deal with in this area, they're just like, as long as you don't take their gun, they're happy. But it's like, you don't understand. The child next door is going to die. And they don't have health care.
Yeah, the GoFundMe's can only go so far, and they're beautiful, and they're feel-goods, and we pat ourselves on the back, but that $6,000 we worked 7 months to raise for a child, it's gone like that.
Yeah.
Yeah,
And
so
that's
it
where your
has-
pharmaceutical
system
argument
has
comes
to
in.
change. Yeah. So
When you
system
have
has
a
to change.
chemo drug that costs $30,000 a dose.
That's a good, someone submitted this question, so we can go to this one. If you could advocate for one policy, one thing having to do with the healthcare system, what would it be? You could change one policy. You just get one.
Let's see, the dream would be to just go to single payer, just make it one.
Socialized medicine.
I'm sorry, to go to single payer.
Medicare for all.
To get rid of the profit.
I would agree with that, and I think that's one of the things that we absolutely have to do for our survival. You know, and I think that we also have to deal with the reality of what's happening right now. And that is, we are still dealing with the chance that pre-existing conditions, you know, that's gonna go bye-bye. There would not be protections. You know, life is a pre-existing condition. We all have it at some point in time. And so, so we have to really put the pressure on the people that need to have the pressure put on them, and that is at the Attorney General's office. Because that's where the suit originates. So we have to call those people and harass them. And you know, one of the things that, I have a little bit different perspective as a result of being a social worker all of my career. And one of the things that I know is so important when I'm dealing with a client is that we have to have a connection, okay? So the one challenge that I would make to anybody who votes is to make sure that you have a connection with whoever that person is that's running. Is it somebody that you know will care about you and will pick up the phone if you call? So you want to really put them to some high standards of what it means to be a representative. We are servants. When we run for office, we are your servants. You are the most important factor. Not what the money they can put in their accounts in the Bahamas or something. You are the most important thing. And so when you look to in that ballot box, who are you going to vote for? Is this somebody that cares about you, or is this somebody that just doesn't give a shit? So think about that.
You know, I think expansion of Medicaid is reachable. You know, we could want the ideal thing, but I believe that we can get the expansion of Medicaid. And I know Maxine and Ken, they work at the free clinic with us in Mountain View. There are so many people that work $10 to $15 an hour. In time they pay rent, car, you know, there is nothing left over for medical care. And they have 3 or 4 kids, they would all pretty well put us out of business, which is what we hope will happen, that if we can expand Medicaid.
And I think one other thing that we also want to look at the potential, because we're going to look at what are the, if we can get this moving in the right direction, we're going to look at what are the steps that we need to take to make this happen. And one of the things that we have in this district and throughout the state and throughout the country is a community health care system. Now the problem with those systems is that some of them are going to be for dental, some of them are going to be primary care, some of them are going to be mental health, although there are very few of those in this district. And that has the potential for expansion that can provide some immediate care. I sit on a community health center board. And one of the things that we have done is we have created that comprehensively. So we have 19 sites in our county that provide services. And so to your question, the person that needs the dental work, I can give you some information about that.
Well, I have some of that.
Okay.
But at the same time, you know, is it the Washington County, what is that called? Great Minds?
Great Minds.
Great Minds, and I know they've expanded into Farmington, and I try to give that information to my students. But at the same time, it's just sort of like there's a disconnect. They don't, I mean, where I work, they have a sheet, a brochure with all the services that are available, and I guess I just need to incorporate it into my classroom so that everybody has it.
And I will tell you, one of the things, because we did an analysis of this, is why people won't accept health care that can be free if they don't have any income.
Right.
Shame.
That I'm sure is a very
People do
big-
not want to bring their mouths in there and to have other people see them. And so when you can work with somebody to get over that piece, then you have a much greater ability to get those services.
Right.
You know, and the other thing is transportation.
That's the biggie.
Yeah, that's the big one, yeah.
I think there might be a follow-up question. Start in the back.
I could take all night here. Believe me, as a person that has insulin, is insulin dependent from time, most of the time, at $900 a vial for insulin, there's nothing you can do if you can't get a hold of the right people. I brought my prescriptions down from well over $2,000 to about $70 a month.
Everybody's gonna be running.
There's a forced thing. What was that?
So everybody gonna be running to you to find out how you did that.
You have to get to the right people. There's places out there that will do it, but that's beyond that. Kathy, it all started back when Bill Clinton was in office, and he signed paperwork to make insurance for profit. And when they did that, they made it basically the same as our government. That's why you have CEOs that are for insurance companies that are making almost $1 billion a year.
Absolutely.
Almost $1 billion a year. Some of the bigger ones are. The only way to take care of that is to go back to where they can't make a profit. Now, how do you intend to get that done? There's your question.
Well, you know, I think what part of it is, you know, informational things like this that we get out to people and we tell them, this is what's going on. And if you want something changed, it always begins with grassroots. You found that out yourself. You had to go find out your own information to make that change. So that's one of the things that I would encourage all of us here to do, is to talk about this stuff with people. And so when you've got that energy, and that movement that says we need change and we need it right now, this is our lives we're talking about, then you can begin to make that change. Now, you know what? All of these people that are making all of this money with the insurance companies, and I have battled insurance companies all my career. I can tell you stories that will curl your hair and your beard about what people tell me. You know, I had somebody that was suicidal, had all of the hallmarks of somebody that's going to kill themselves within the next 24 hours. And so I called what was the insurance company, and they said, we don't cover mental health care. And I said, well, what am I supposed to do to get this person admitted to the hospital? She said, tell them not to do it. I said, who's your supervisor?
In the work with that, my doctor, that has been my doctor since I was 18 years old, did a lot of work for me to help me out and put me in the right, point me in the right direction. Your doctors can do it. They just don't send that, send you a prescription, send you home, and you gotta pay, $400 for a prescription.
Yeah.
They can help you by getting you as cheap as possible.
Yes.
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 And right now, I'm spending about $50 a month on my insulin, total, and then all of my other medications are, like 40 some odd dollars, I think, something like that. But, I was a worker. I ended up with 3 back surgeries, and a couple of car accidents and things like that, and all of a sudden, I'm out of work. So we're out of work. The insurance that my wife has, or she was my wife, was going to be about $900 or so a month for the insurance. And me looking at that and figuring out on my back surgery that it cost me $220,000 for my last back surgery, and my insurance company paid $7,000.
Follow up on what you're saying. 1/4 of prescriptions never get filled when they see the cost of the medication. They turn around, and whether it's an antibiotic they need or whatever, and walk out.
I used to do that too.
Right.
And some of that's drug.
Kathy, I ran into an individual that I worked with, and I had respect for, I kind of lost it, but we were talking about, something similar, and his comment was, and I've heard this before, is, I'm only concerned about my own. And I know that comes out of fear, but how do you combat that, and what, I'm a firm believer in how you word things is how you change people's minds. You can't say, you're an idiot. That does nothing. Or, and even those facts don't seem to budge people. There has got to be a psychology involved in how you word it, and as a counselor, I'm sure you know all that. Maybe you don't even know that you know it at this point. But there's got to be, how do I talk to somebody that says, the first thing is, you selfish son of a what? Right. But it isn't going to get anywhere. And what do you say, and how do you word it to get, to persuade people to understand this?
You sit quietly, you listen to what they have to say, and then you ask them, can you tell me a little more about that? Okay? And so if you have the place that you can talk to them, and they're willing to talk to you, just ask questions. And try to ask questions without a tone. And
It's real hard for me.
yeah. And you know, you may find that you don't like what they stand for, but the reality of it is everyone has a story. And every story, if we have all of the information, makes perfect sense. So if you see somebody's behavior, and I've worked with people that have had extremely bad behavior in their drinking or using careers. But everything that they did still made sense. And when they began to get sober and realize that, then they could begin to take their power back and live empowered lives. So when we ask people a question, it gives them the opportunity to speak. It's not a challenge to prove their point. It's a question.
I'd like to open that question to everyone because that's a question that was submitted. How do we talk to our neighbors about this issue?
What she just said, no. I mean, first of all, I agree with everything she said. It's really important, I think, but obviously she's experiencing this a lot on the campaign trail. For me, one of the reasons I got this topic being interested is because this happened to me, and for so long, and someone brought up the shame. I didn't have health insurance. You know, I was young. I was like, it doesn't really matter. And then things start to happen. You start to wonder, well, I need to go to the doctor. Where do I go? Oh, there's a clinic. You start trying to go through the steps, and like you said, that shame kind of follows you, and you don't want to talk to your neighbors. You don't want to talk to your friends. And then when you finally do, like, I finally had an experience of going bankrupt, right? So people, what happened? And I start to tell them, well, I got all these medical bills. Oh, that happened to my cousin. Or, oh, I'm just saying, that's my fear, or my cousin, my brother, my uncle, and people start to realize there's so many of us, and they live next door, they live across the street, they live across town, they live in the Boot Hill, they live in Jefferson County, they live, I don't know how far you go, or how pretty far, I know. So, we all are kind of experiencing the same thing, and just talking about it, whether it's small tips of the conversation or something more in depth, like you're talking about, or like you were talking about, just so people understand that we're all kind of going through the same experience. I think that's the at your church, at your barbecue, at your school, wherever you're at. So.
Oh, sorry.
Yeah. I just one other thing is to also to be in that place where you can truly hear what somebody has to say, and you have to really kind of have everything together to make that happen. We need to learn to compartmentalize because when we can put our own beliefs away and truly hear what that other person is saying, we don't have to agree with them. We don't have to give our own personal values, but we do need to just listen to what of that makes sense. What about that? We live in a society where a huge number of people are the victims of trauma. And I know that trauma has been talked about a lot I don't want to make that seem like it's something that's very cavalier. It's not. It's a very significant thing. And the difference in the success in having some sort of a conversation with somebody, if you have some awareness of trauma, most of the time in my early education as a therapist, we would say, well, tell me what's wrong with you. Okay.
No.
We come to people, if they think they don't believe what we believe, there's something wrong with them. Okay? So we come armed, and they come armed because they are fearful and they don't want to be vulnerable. And so when you talk to people and you can say, what happened to you? That's the game changer in terms of dealing with any traumatic experience. Tell me what happened to you. Because then it's like, oh, it's not my fault. And all of a sudden, that shame begins to dissipate and that fear begins to dissipate. And then you can have a conversation. And to be respectful of whatever their boundaries are, and to be respectful of what your boundaries are. To know when you've had enough of the conversation and it's time to go get, a soda or something and say, let's just sit down and watch the fire here and not talk about that. So, you know, you have to do your own work in order to have a successful conversation. And it may still not work out. It's not your fault. But you try again.
I would say first and foremost, it's done become one of Kathy's forums.
Yeah, good job, Kathy, that was perfect.
We're talking about those issues right here and we've got a broad range of ideas. When I ask them, I say, first of all, do you have insurance? And they do. I say, will your insurance cover a cancer problem the second time? They don't know. I ask them, I said, what if they decide that it's a pre-existing condition the second time? What will your insurance continue to cover? And if it's an expensive medication you need, is it covered? They don't think about it. They don't really think about it until they get in that situation where their insurance is in play, and then they have the problem. And then it's an individual situation. And my last question is, if they won't take care of that, if they won't cover that, you're gonna sue them? Really? And insurance, you're gonna sue those insurance companies? Yeah, good luck.
Yeah. I have asked people that I know who are against the Medicaid expansion, why do you feel like it's a good idea to deny, and I use children and the elderly, because a lot of the people that are on Medicaid are elderly people who have Medicare as a primary and have Medicaid as a secondary. And I said, what makes you think that we should deny those people that coverage, you know? And they can never give me an answer. You know, a lot of them will say, well, those people shouldn't have had those kids. It's too late for that. The kids are here. You know, but they can never give you an answer as to why they feel like it's important to deny that health care to those people. I've never had one person.
Because they're being manipulated.
Exactly.
They don't wanna pay for it.
I go, because somebody told them to be that way.
Yeah.
I hate to say it, but it's true.
They just want born hackers.
This is anecdotal evidence, sort of, but I've been gathering signatures since before we officially launched. The absolute most common thing, I'll be standing there and I'll approach someone and I'll say, hi, would you like to sign the ballot initiative to get Medicaid expansion on the ballot? Either no, or what's that, or something, and then you explain to them what it is. I cannot tell you how many people say, oh, that's me. I'm that person. I'm the one that works at the restaurant and doesn't have health insurance. And it's just, this is really important for people to understand that this is, we're talking, like Kathy said, this is an experience we all share. And a lot of people don't even realize this, whether they're being purposely manipulated or just don't know that it's even a thing, that's even an issue that they can do something about right now. It's really empowering.
See, and this is not just, I worked in St. Louis when I lived in St. Louis with a bunch of bohemian types, and no one had insurance, and everyone was just like a wing and a prayer. And I was really well acquainted with that, but what I wasn't well acquainted with was when I got married, and my husband's family, old school farm family, they're like, no, none of us have insurance, and I'm like, what? Because my dad is a retired RN, and my mom always worked in hospitals. I'm like, you don't have what? And they're like, no, we can't afford insurance, so we just hope that nothing bad happens. I'm like, that's terrible. That's a bad idea. You guys shouldn't do that at all. So because I was irritating for a really long time, and when I had my son, I was like, no, everybody's getting insurance. We all need insurance. Enough of you guys are insane. And so what happened was they tried to go through the exchange, and they couldn't understand it from the website on their own, and they're just like, oh, what I punched the numbers in, and it was way too high, so there's just no way. But what people don't know is that there are people who can help them navigate the system and get them actual good coverage and try to help them. And we're in a better spot than we were, but we still need Medicaid expansion / Medicare for all. But it's not just the bohemian types, older farm families that did not have insurance at all. And luckily they got insurance at the exact right time, because my husband's brother was 23 and had a heart attack completely unexpectedly. And then 6 months later, his dad had a heart attack. He had to get a triple bypass and or quadruple bypass and stents put in. And then his uncle had open heart surgery like a few months after that. And then Steven found out that he had like high blood pressure and cholesterol issues. Like all of this would have gone completely unchecked. And like if Brady wouldn't have had health insurance, he's a 23-year-old man. He has his third kid on the way. He and his wife, like they've been together since high school. Like he probably wouldn't have gone to the hospital. He might have died in a field without having insurance, without having that, and not knowing how to navigate a broken system. Could have killed pretty much my husband's entire family. And just the thought of that is just so upsetting. And my brother, he's type 1 diabetic, and he and his wife moved to Germany because he was starting to get macular degeneration, and he had, all these health problems, and he's like, I'm just going to leave America because this isn't working, so I'm just going to leave. And then he did, and he sent me like a picture of a mountain of medicine that he got for 38 euros. And I'm like, what? This is insane. Sorry, that was anecdotal. And
My son is in Germany, and they moved, and the week that they were there, the baby got a respiratory illness, and they took him to a German doctor, and they said that'll be 100 euros, he said, do you have euros? And he said, no, I don't have any euros yet. And they said, oh, well, you weren't in here that long, don't worry about it. And then, they didn't have to pay anything. And she's Japanese, and she had the baby here in Utah, and she's still fuming about the hospital bill. She's just furious, and I think that's why, part of the reason that when they leave Germany, they'll probably go to Japan. He does not want to come back, because part of it's the health care. The baby was in ICU for, I think, 7 days or something like that, $16,000. And she paid nothing for the first 4 months while she was in Japan, getting, the sonogram and everything done, and she just went in, got checked, and left, and there was no charge. So I think the outrageous cost of everything, she just, like, why would we want to stay? And that's something to think about.
Okay, we had a lot of duplicate questions submitted, so I think we have 2 more unique ones. And then after that, whatever time we have left, if you didn't get your question answered, we can open it up to the floor. Did you have?
Are these?
Oh, I haven't seen those. We might have more. Okay, well, I'll go ahead and open it up. We'll start at this end this time. What changes do you all anticipate seeing in the next year?
I anticipate it's not going to get better within the next year. I think the greatest hope is this petition right here. When you sign that, I think you've done one of the largest things you can do, but there's more important things you can do. A vote for Kathy sends the message to our congressman, who is one of the most, I don't want to use the word conservative, but I served with him in the House, so I know him very well. We had our districts joined, and so I can tell you that he has no compassion. He thinks everybody needs to pick themselves up by the bootstraps, and I can tell you time and time again, the House floor, how he voted, and you can check in Washington D.C. how he's voting there. He thinks the president is the most wonderful person that ever set foot on this earth, and he is just absolutely got Potomac fever. He's overwhelmed with himself. The best message you can send for him, the more votes that this lady gets. He's going to send a message to him that something's wrong. Now, if she wins, we won't worry about him anymore. But regardless, every vote that she gets above what she got last time is going to be a message that he will understand. 2 things a politician understands, and I was one: the threat of money, the benefit of money, and votes. You bet.
Right.
Yeah. Being a Democrat, I never got much money, but I understood what it could do against me.
I go along with JC said.
Okay.
Well, I want to just add a little bit to that, because one of the things that has happened is kind of interesting regarding Mr. Smith, and that is he recently signed on to expanding community health centers in the country. So a little bit of pressure makes a little bit of change. Thank God he did that, because we need all the help that we can get, because we're struggling right now in our community health center, and I know everybody else is too. And so if we can move the needle that way, that's successful.
And I can guarantee you, you were a part of it, a huge part of it. Because without you, we wouldn't even be talking here. We wouldn't even be having this conversation. And he wouldn't be we wouldn't be getting his attention.
32 health centers around the whole country, or just?
They're across, there are hundreds across the country.
Okay.
That provide services, and they provide, you know, if people don't have anything, that's part of what it is they serve them regardless of what they have in terms of money. This is a program that was started, it was in the Johnson administration as part of the war on poverty. And so they decided that community health centers needed to be where the need was the greatest, which was in the cities at that point in time and in the rural areas. So they began to develop those. And so what it stipulates is that if you are a member of the board of a community health center, 51% of the people on that board need to be consumers of services. So I get my dental care from my community health center board. I have insurance that will pay for that, but I also have to sit there in the waiting room. I know how long it takes. I know what's going on. I hear what people are saying. I know what the service is like. So as the vice chair of that board, I have a good handle on all of our sites. So you have a governing body for every one of those health centers. And so we've got those throughout. You can get Jason Smith should have in his office a map that shows you exactly where they are and what services they provide. So since I've been on the board, what has happened in the state is that we're moving toward comprehensive health care for everyone. So we will have primary care, we will have dental care, we will have behavioral health, and we will have drug and alcohol services in one area, in one, particular community health center. So that, I think, is the great future in terms of a stopgap until we can get to Medicare for all, till we can get for any kind of a single payer.
You say those that they exist now, and
Yes.
there's some in this district?
Yes.
And he has the map that shows where they are?
He has the map.
So
It's got his name on it, but I use it a lot.
But I mean, we can get a copy of that.
Yes.
Sure.
Yes.
A year from now, we're going to be getting ready for the vote to pass the Medicaid expansion. You're gonna all see a lot more of me, and you're gonna be, but I think it's gonna get on the ballot, hopefully by a landslide. I hope it's kind of everybody will be engaged, and I think that's the big thing, is we'll build a lot of engagement, a lot of excitement around this issue leading up to that election.
Great. Okay, we'll throw one more question in from that 3. District 8 has long been underserved on reproductive health. Imagining this question came from our friends at Planned Parenthood that are here. What opportunities do you see in the region to expanding access to birth control and contraception? And then Kathy, I'm assuming this part is for you. Would you commit to expanding these services? Dr. Roberts, this might be something you can speak to out of your clinic. Is this something that you see commonly? What room is there to expand that?
When I first went to practice 42 years ago, all the county health departments had women health exam. They could get birth control and no questions asked. And as reproductive health became, people started talking about abortion, and they forgot about all these young girls that are getting birth control, and that your abortion rate will go down. Well, they would not look at that. They just heard the word abortion. So what you saw, the counties lost financing for their family planning clinics, and as a result, pregnancies went up. So it's been proven, if you have contraception available and family planning clinics, abortions go down. So hopefully that will be something
And the same
that happened
people-
in Denver, Colorado with the governor, and they put in, and it was a remarkable drop in the number of abortions.
Well, I'm really pleased this is really exciting news, that Planned Parenthood has now been organizing in the 8th district. And we have a representative there that can answer all your questions. The question that was specifically to me, would I support that? Absolutely. I think it's the best thing that's happening. I will tell you that makes a huge difference when I go to talk to people in the St. Louis area. When I can say that we've got Planned Parenthood coming into the 8th district, they're like, whoa, there's some changes going on. So that's a really, really good sign.
Where is that representative?
Aaron.
I'm sorry, okay, I'm sorry, Aaron. Hi.
And we'll stick around a bit at the end. I'm sure Aaron will for a minute as well if people have questions. So the last question, people didn't submit this, but I would like all of you to talk a little bit about what can these fine folks do next to keep moving this conversation forward? What are the next steps for people?
As I look around this room, I can tell you most of you, the majority of you, are at the most influential point in your lives. Never before have you had the influence you have now, especially if you're still working and still active and still serving out there in the community. Because at your age, people like to, young people, middle-class people, they like to hear what you have to say. I'm talking about your family and your friends that you sit and play cards with or sit at the table with. And you have an opportunity to give them a gift more precious than anything else that's available to you. And that is the gift of informing them about what we've talked about here and the effects, the examples it's been giving. And they're great examples in the terms of showing what the cost is to not doing something, to setting back and letting things go on as they are. You know what some of the things, I've mentioned 2 of them. And again, that vote sends a strong message. The insurance companies, I dealt with them in Jeff City more than once on different issues, and I'm not going to go into what the issues were, but I'm telling you that they would just put a stop to it. They'd put a stop to it. And because they've got the money, and they'd go to those legislators, and they'd say, we're going to cut your money off. They'd go to the party. They'd say, we're going to cut your money off. Kill that bill. That's what you're paid to do. That's what we pay that money to you to do, is to stop that. They're powerful, folks. But you know what? There's more of us.
Yes.
More of us. And we
I agree with JC, and I think if you each can learn 5 important things about the expansion of Medicaid, that when you talk to somebody, don't get confused with 20 or 25 things. Have 5 things that it's going to help rural hospitals, and have those 5 things and explain that to them and know it well enough if they ask you a question that you can respond to it, and you plant the seed, and then hopefully we'll see results.
Yeah, and I think that, if you have a topic that you want to have a forum on in your area, give us a call. That's what we're going to be doing now, from now probably until the election in 2020, is that we're going to be meeting with groups of people like this. But remember that the most important thing here, I came across a really interesting quote from a former justice of the Supreme Court, who said that more than the President of the United States, in terms of his power and in terms of his duty, is the citizen who is the most powerful of all. So remember that you are the most powerful of all, regardless of everything that's going on in our country right now. You have the power to speak, you have the power to move people, you have the power and the authority to say, I know what I'm talking about. And this is not working out for us, folks. So challenge people appropriately. Tell them what you know. Share with them. You never know when a little seed's going to get stuck in their brains, that they're going to start thinking about something. And then we can move toward change. So that's what you can do in your environment, in your area. And you have the power. Use it. You are a patriot. Don't forget it.
Amen.
most all three of you said something more eloquent than I could. I was thinking the whole time, each one teach one, right? Kind of spread the word, you know, get people involved, talk to your friends, your family. Let them know there's people out there that are carrying this fight on, right? Because I know sometimes it can get discouraging. We feel like we're alone. And we see all this stuff on the news or on Facebook and think, you know, I'm sitting here in this little place by myself. You're not, right? There's plenty of people out there. And crossing those bridges and building those bridges across things. Because again, this is an issue that I think, like we talked about tonight, that crosses all of those boundaries, whether they're real or imagined, that everyone needs to kind of share it. And someone's wiser than me said it's the morally responsible things to do, it's the fiscally responsible thing to do. It's very rare that we have that easy of a kind of slam dunk as far as the Medicaid expansion, right? It checks all the boxes. There's really no reason that it hasn't been done 10 years ago. So shame on every board it hasn't happened. So.
Thank you all. Can we give our panelists? So I'm going to throw in a few things before we head out. First of all, if you haven't signed the Medicaid expansion petition, come find Ken. I'm sure he'd be happy to track you down like a dog. We'll find you at the next forum. If you have questions about Planned Parenthood, you can find Aaron. A few more things. Kathy mentioned this. We have asked folks in their areas to host community forums just like this. We agreed to be the first pilot one. We felt we had to take it on ourselves before we could make other people take it on, but some of those fine folks are here in this room actually tonight, so I'm going to preview 2 of them, and then if you have additional questions, you can find them after. So the next one we have coming up is a community forum on recycling. It's on October 21st in Farmington at Coljack's. Is that right?
Yes.
It's being hosted by Mo and John Bales, who are in the Citizens United t-shirts. So we would love to have you up there. There are flyers for this on the back table, so feel free to pick them up. They're close. It's close to here. We would love to have you all at that one. The other one, it's a little further out time-wise, but on November 12th, we're going to be doing a forum on childcare, affordability, and accessibility. This is being organized by Liz, who is in the back here. And that's November 12th at Mineral Area College in Fredericktown. So there's also flyers for that in the back. Pink is childcare, orange is recycling. There's going to be a lot more of these in between these two. So like our Facebook page, Kathy Ellis for Congress, we'll be posting them. Social Security, healthcare, 2 more times. We've got all kinds of things going on. So, and if there's an issue that we're not covering and you want to host it, call me and we'll put it together. They're very straightforward. I think the folks would agree they've been working on it. The other thing we have coming up this Sunday in Fredericktown, Liz is hosting a very casual meet and greet. Let's taco about it. We're gonna have tacos. It's at Liz's house. She's been so kind to host us. So there are flyers for this in the back as well. This is casual. We'll be hanging out. Feel free to come join us. We're praying for really beautiful weather.
Can we bring our degenerate children?
Yes. Yes.
Cool.
So we're going to blatantly say this. Children are welcome at every event we ever do. We have coloring pages in the back. This was Liz's idea. Probably why she's hosting the childcare forum. But coloring pages, we'll have them at every event. So bring your kids, bring your family. We're open to all. And if you want to host one of these, you give me a call. So.
Every event is going to be handicap accessible.
Yes.
Also.
Yes, and if additional accommodations are needed, please contact me. Our cards are in the back. We're happy to make accommodations. So we want folks to be there.
And probably that they're on Facebook Live if people can't attend.
Yes, so we Facebook Live this one. Let's hope it worked. It seems like it did. So we'll be recording all of these. They'll be on our Facebook page. We're only recording the panelists, so you all are not in it. But go watch them. If you can't make them, we'd love to have you. Anything else I'm forgetting? Yes.
Mr. Josh Gilmore?
Yes, sir.
I think I'd be, we doing ourselves a disservice if we didn't ask, how is the hospital issue going?
Well, it's slow right now. We are still mired in getting the bankruptcy Chapter 9 confirmed through the courts. We have some fundamental disagreements with the USDA, who holds the bond on the facility itself. Right now, we don't have a final date for our hearing. We had one set, and it got postponed. The USDA has put a motion in. They believe that there may be a conflict of interest between our attorney and one of our vendors. We disagree. So that's mired in the court system right now. Until that's resolved, were just kind of on pause. Overall, things are actually going really well. We've had a lot of positive movement. We've had Medicare came to the table in a very meaningful way regarding the past debt that we had, and we have an agreement in writing with them that will allow us to pay back the past due cost report stuff over a 10-year period with no interest. It's huge. I mean, virtually unheard of for Medicare to be able to do that. Medicaid came to the table in a very, very meaningful way. We worked with them over the past year, and we had about $3.3 million due back to them from disproportionate share payments from the past, and as well as a payment due back literally from when the hospital opened its doors, and they had paid us an interim rate, and they had overpaid us. They had never come back and asked for it because they knew that we were so fragile. Asking for it would have triggered a take back, and it would have closed our doors. So we met with them. We came to an agreement about what we literally could afford to pay back over the 5-year plan period of the bankruptcy, and they've agreed to literally write off 82% of what we owe. So we have everything is literally lined out for long-term sustainability. We've just got to carry this across the finish line. And that means getting stuff wrapped up with the USDA. And let me be very clear, our disagreement with them from our perspective is very fundamental. We absolutely agree that they should be paid everything they are legally entitled to. Sure. I don't dispute that one bit. But we also believe they should not be paid more than that. And that's where our fundamental disagreement comes to bar. In fact, what they would like to get from us would put our long-term sustainability at risk. And so we're not going to agree to do that.
Is there anything we can do?
Just continue to push on our representatives and ask for their long-term support of the organization. There's really very little that anything can be done right now because it's in the court system. I was in DC 2 weeks ago meeting with all of our delegates, and I've gone to other agencies and asked for their support as well. We really have huge support. Everybody wants to see us succeed. I believe the bankruptcy judge himself wants to see us succeed. I think we ended up with a really good judge. Couldn't have asked for better in that situation. But again, it's just a matter of getting through the legal mire and getting this over the finish line. But we're not going to yield an inch. We're going to get there. And the truth is, the future looks very positive, and we are continuing to grow what services we can offer to this community. I know rheumatology has been a big challenge. That's growing, and I'm looking forward to continuing to explore what else can we bring to bear to meet the needs of this community in a sustainable way. And your guys' feedback as far as what that looks like helps us to know what to go after. But overall, it really is going really well. We have a small reserve built up, thank God for the tax that we've been able to collect. We now have a buffer, so if something does happen, we're not instantly in, dire straits. It's not. We have about, I would say, 22 days cash on hand. That's a finger in the wind. But that's a hell of a lot better than zero.
Right.
So. The industry best practice across Missouri for critical access hospitals is 72 days cash on hand. I'm going to be really excited if we can get to 36.
Sure.
Because it really truly does mean long-term sustainability for us if we can do that. And we're doing everything we can to systematically move towards that. Working with all of our providers to make sure we've got the right people in the right place. One of the changes you'll have noticed over the last couple of years is we changed out our ER. And nothing wrong with the folks that there were before. They were clinically fine, but to me, when you go into a rural facility and do an emergency room, you want a doctor there that knows rural, that knows what it means to be the one guy that's making the decisions and wearing all the different hats, instead of somebody from a big city that's used to having 27 people he can call on to take care of everything. And it's a difference in the quality and the delivery of care. And I think we had a lot of challenges with that with the group we were with before, because we were getting people that were used to that kind of a coverage, and they weren't used to rural. And they were, you know, honestly, I believe a lot of them were coming to the rural because they were hoping that it would be really slow. I'm like, are you kidding me? Guys, or anything but that. I mean, we, as was mentioned before, we get all kinds of stuff here. I mean, you know, the emergencies that show up on our doorstep vary enormously. I mean, we do lots of car accidents and traumas and heart attacks and strokes, and if we don't have the right people in the right place, we're not going to have the quality of care you guys deserve. So we're really trying to build the quality team that's going to be here for the long term.
And as a grandma, I would ask everybody to pray. And this is my son, and so prayer always helps.
As I said before, that hospital means a lot to me because I was very involved in getting it up and running. And so I'm thinking when I'm reading this in the paper, the problem that's going on up here. You've got a congressman that says he's in the president's office, that are having breakfast together and tea and crumpets, whatever they do. You got two senators that are of the same party, and they can't bring that federal agency to the table. I guarantee you, you put this lady in there, and she will be there. She will understand the issue, and she will have it at the table. When you're talking about a economically distressed county, a critical access county, and he can't do anything about it. You know, one of the worst things to have someone representing you that don't know how to use their power. We gave him the power. I didn't, but the district gave him the power, and he doesn't know how to use it, or he don't care.
Well, in my role as the administrator, you're well aware I cannot. I can say that across the board, since we've been dealing with that, irregardless of party, we have had very, very strong support. That the degree to which anybody can step in and assist us, they have. But I do know that because of our contention with the USDA right now, and because it is, in a lawsuit, they cannot directly intervene.
I understand that. I just
want to be.
Sure. You didn't say this, I did.
The ironic thing about this is, all these rural hospitals, not this one, because it's much newer, but when all the rural hospitals were built in the 40s, 50s, and 60s, they were built under the Bill Burton Initiative. And that was a government program to bring healthcare to the rural areas. And now it's like, we needed it back then, but we don't need it anymore.
Well, and they abandoned it. I mean, here's a facility, and now you can't afford to take care of it.
Yeah, that little hospital at Donovan was a Bill Burton hospital.
I would like to also add that another way to help Missouri Healthcare for All is when they start going to Just City to advocate, and they put the call out over Facebook. We need people to show up here. Show up. That's what I did last year. So.
And you can go meet your representative, and
they'll give you the talking points. It's not hard.
we meet with everybody we can up there. So.
That's right.
And Medicare expansion does, I can honestly say, Medicare expansion will help all rural hospitals. Now, it will vary by degree depending on your particular demographic, how big the effect will be, but it will be positive.
It's definitely helped the hospital massive.
Well, thank you all so much for coming. We'll stick around for a few more minutes, but I know that the library staff wants to go home. So thank you all. I will give you a